I'm Dr. Roger Knapp, pediatrician. Let's talk about fevers. Almost always it's caused by infections, but there's a few rare other causes. And then especially in kids, we worry about what disease is going on. Fever is usually worse at night and not as bad during the day. Cough is worse at night. Ear pain will be worse at night. It's the cycle that always occurs, and that's why they always tell you have to be 24 hours with no fever to actually know it's gone. Fever, in the old days, they worried about it being real high and harming the baby, but it does not harm the brain. Fever, whether it's 101 or 104.5, won't hurt the baby. Now, if you forget your child's in the van in the summer and you cook them to 107, that's heat stroke. That's different. Fever from an illness never hurt anybody. It's a disease that harms the child. The child had meningitis or measles, not fever, that damaged the baby. And so we don't panic over fever as far as how high it is. If the child is really burning hot in the middle of the night, you really don't have to take the temperature. It's obviously 101, 2, 3, 4, and the number doesn't matter. You're going to give Tylenol or Advil to treat the fever. But we want to see the baby to see what's causing the fever. We treat fever with Tylenol or ibuprofen, Advil, Motrin. Because fever doesn't harm you, you don't have to alternate Tylenol and ibuprofen. It's actually too many chemicals to your liver, and that's not good for your liver. We recommend giving either Tylenol or Advil, ibuprofen, but many emergency rooms will tell you, to get the fever down and bathe them and alternate Tylenol, Advil. It's not necessary. In fact, if you take a petri dish of virus, bacteria, and raise the temperature 104, they're damaged. It harms the germs and it mobilizes your white cells. Fever's been around since the caveman days to help us fight off infections. So fever's not necessarily a bad thing. We recommend giving Tylenol or Advil for fever because it really helps the body aches. You just hurt with fever, but it's not because we're trying to eliminate it. And many parents come in saying, well, Dr. Knapp, I gave you Tylenol and it's still 102. And I said, well, it didn't go to 104. These medicines do not prevent fever. They do not mask it. It just causes you to have less fever. So we worry about what illness is causing the fever, and any fevers in the child, please contact your physician the next morning and get an appointment to see what's causing it. Thank you. This is Dr. Roger Knapp.